Lawsonia and Salmonella are two of the more common pathogens that we see in pigs in the United States. It's logical to think that those two diseases are going to be present together a lot of the time because they're so ubiquitous. They're so commonly found. Of course, when we think of the clinical signs of Lawsonia and Salmonella, we think of some degree of diarrhea. But you know, when these common organisms are found together in the pig, we can see a wide range of lesions. We can see pigs with Salmonella and Lawsonia have the gamut of extreme diarrhea, even with blood present in the feces, all the way to acute septicemia with some Salmonella. When those two organisms, when Lawsonia and Salmonella oftentimes are present together, they have an effect that's not additive, it's multiplicative. One of the larger tasks as a veterinarian, I've heard it said, I've been told this, that the role of a veterinarian is to understand when you need to use a product, to use the product. Understand when you don't need to use a product, don't use a product. But the real trick is to know the difference. The problem with using antibiotic treatment against Lawsonia and Salmonella is by the time you recognize that the pig is ill, traditionally it's a diarrhea, we've already lost performance. The changes have already occurred in the intestines. The damage is already being done before we intervene with an antibiotic treatment. That's why vaccination is so much better, because truly we're getting into the opportunities, as an aid in the prevention of these diseases as opposed to an aid in the treatment of diseases. When we talk or we think about vaccines and vaccination for Lawsonia and Salmonella, they're so common, they're so ubiquitous. We need to intervene because what we're doing is we're ending up losing productivity because the pig is having to deal with these organisms. That's why we should vaccinate, because it's one, very common, these organisms, and two, they rob production.